Okay, Andrew, so before we start, I'm just going to run you through an adult pre-exercise screening tool. This is just to see if you have any medical conditions and to then construct a program around your results of the test. So I'll just read you out the aim of the stage 1 of this. It is to identify those individuals with a known disease or symptoms or signs of disease who may be at a higher risk of an adverse event during physical activity/exercise. This stage is self-administered and self-evaluated. Usually, you would be able to fill it out yourself, but because I'm here, I'm just going to run through the questions with you. So, Andrew, what is your date of birth?
4th, the 8th, 91.
Obviously a male. No problem. Okay, the first question is, has your doctor ever told you that you have a heart condition or have you ever suffered from a stroke?
No.
Next is, do you ever experience unexplained pains in your chest at rest or during physical activity?
No.
Do you ever feel faint or have spells of dizziness during physical activity/exercise that causes you to lose balance?
No.
Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
If you have diabetes, have you had trouble controlling your blood glucose in the last 3 months?
No.
Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity/exercise?
No.
Not a problem. The last question is, do you have any other medical conditions that may make it dangerous for you to participate in physical activity?
No.
Great. So you answered no to all 7 questions. So we have no concerns about your health, and now you can proceed to moderate to light intensity physical activity. Great. So if you could just sign and date the bottom for me.
What's the date today?
31st. Thank you. Alright, now there's also stage 2 of the pre-exercise screening, and the aim of this stage is to identify those individuals with risk factors or other conditions to assist with appropriate exercise prescription. This stage is to be administered by a qualified exercise professional. So I'll go through this one with you, and yeah, if you could just answer the questions, that would be great. What is your age?
23.
And you're a male. Great, so because you're 23 years aged, you are of no risk for participating in an exercise program. Any family history of heart disease or stroke?
No.
No, great, so there's a 0 in that one. Have you ever smoked?
No.
Excellent, no risk factor there. Please describe your current physical activity. Would you say it's sedimentary, light, moderate or vigorous?
Vigorous.
And how many sessions would you say that you completed per week?
5.
And what's the duration of each session?
60 minutes.
60. Great, so you participate in over 150 minutes of exercise per week, so you are actually a -1 risk factor for that. Question, do you know your height?
180 centimetres.
180. And then your weight?
72.
Great, and we actually calculated this before, but you do have a BMI of 22, which puts you in the non-risk category. Have you been told that you have high blood pressure?
No.
Excellent. Have you been told that you have high cholesterol?
No.
And have you been told that you have high blood sugar?
No.
Great. So your total for this stage is -1 at the moment. Question 9. Have you spent time in hospital in the last 12 months?
No.
Excellent. Are you currently taking any prescription medication?
No.
Great. You're obviously not pregnant. And do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
No.
Great. So when we go down and look at your risk stratification, your total for this stage is actually -1. So if you have a look here, you are a low risk client. So that means that any individuals at low risk may participate in aerobic physical activity / exercise up to a vigorous or high intensity. So if you have a look on this sheet here, you can participate to up to 70 to 90% or even over 90% of your maximum heart rate. And we also don't need to send you to any medical professionals because you are all good. Thanks, Andrew.
Thank you.